Progesterone, the mother hormone. So this lesson is for all women who are struggling with hormonal imbalances. If you have hormonal imbalances, maybe you have an irregular cycle, you don't have a period, you're unable to conceive, you have fibroids, you have ovarian cysts, you also have endometriosis, things like that. This video is gonna help you a great deal. So my name is Nasteri and I help women heal and balance their hormones so that they can boost their fertility, have regular cycles, and feel whole and alive. So today I'm using an improvised whiteboard. We're going to talk about progesterone, which is also called the mother hormone, and I'm going to be explaining to you why it's called the mother hormone. So it's called the mother hormone because when this hormone is low or when it is imbalanced, all the other areas in your body, they are gonna feel it. Like all the other hormones in your body are gonna experience a shift, or they're gonna be affected in one way or another. So before we go into depth, it is very important for us to talk about what is the function of progesterone. Like what does it do help you do in your body? So number one, it's gonna help you to balance the estrogen in your body. A lot of women, especially those who are using hormonal contraceptives, you find out that your estrogen is gonna get so high and your progesterone gets so low, and this imbalance is a catastrophe. Let me call it that way. It causes estrogen dominance. That is this hormone that is not supposed to be like the mother becomes the mother. By the mother, I mean like it should be like the dominant hormone. So the role of this progesterone, when it is being produced in a good amount, it's gonna help to balance out estrogen. Then number two, it's gonna help you to support ovulation and fertility. Without this hormone, without a good balance of the progesterone hormone, ovulation and fertility, your ovulation and fertility is gonna be impacted. So you may find out that you are not ovulating, and let me use maybe another pen here. So you are not ovulating, you may not be ovulating, and your fertility is gonna be affected. Like you're gonna maybe struggle with trying to conceive, like you're not able to conceive. And then number three function is that it helps to calm the nervous system and also helps to reduce anxiety. You may find out that sometimes as a woman, there's sometimes where you're feeling so anxious. So your progesterone hormone could be maybe off. So calming the nervous system. So that is another function. As you can see, this hormone, it's not only restricted to fertility. You can see even when it comes to the nervous system, this hormone is very, very important. And then number four is that it can help to improve your sleep and mood. So how well are you able to sleep? How is your mood? There are some women who, when your period is about to begin or during some days to your period, you start becoming extremely moody and your sleep is disrupted. That should tell you that your progesterone is off. So it is not a woman thing. It is not a normal woman thing to always have moody or to have moods because you are on your days. That shows there is an imbalance. There's nothing like I'm on moods because I'm on my days. Your progesterone is off. If you balance your progesterone hormone, you're gonna have good moods at all times. I'm not saying that you will not be, I'm not saying that you'll be happy at all times, but your mood is gonna be balanced or optimal at most times. And then number five is that it's gonna help you to prepare your womb, especially for women who are trying to conceive. So it's gonna help to prepare it for a possible pregnancy. So if you don't have good amounts of progesterone, you're not gonna have this done. So implantation is gonna be very difficult, or you may find out that you cannot maintain a pregnancy. And then number 6 function that is very important is that it's gonna help to prevent PMS symptoms. Symptoms, these ones are, for example, when your period is about to come, you may find out that your breasts are very extreme tenderness of your breasts, and then low abdominal pains, fatigue, all those symptoms that you feel when you are about to have your period, those are PMS symptoms. And if you have a good balance of the progesterone hormone, then these PMS symptoms are gonna be regulated, or you're not gonna experience them. So it is not a normal woman thing to have extreme breast tenderness as you period is about to begin, or the low abdominal pains, or the fatigues, or extreme PMS symptoms. Yes, you may have some, but if it is disrupting your everyday life, then there's some progesterone imbalance and you need to take care of that. When the progesterone hormone drops, what is gonna happen? So that is what we're gonna talk in the next slide. So when the progesterone hormone drops, like, what is gonna happen to you, or how are you gonna know that you have a low progesterone level? So number 1, you're gonna have irregular. So for those of you who are texting me telling me that you're not having a regular cycle, progesterone, that is a good place to start. So you're gonna have irregular or very short cycles, and by short cycles I mean when your cycle is less than 21 days. Maybe it's coming at day 12, day 14, day 16. So all of these problem, progesterone, it's a good place to start. And then number 2, the PMS symptoms that we talked about, you're gonna experience them like at the breast tenderness, like your breasts are gonna feel so tender, and you're gonna feel so irritable and have anxiety, especially around the time that you're supposed to have your period. So PMS symptoms that we've talked about. And then number 3, you may find out that you're spotting before your period. That should tell you there is a problem with this hormone and you need to do something about it. Poor sleep, like you cannot sleep, like I don't know how to, like you're just not able to sleep. Poor sleep is a problem as a woman. Yes, that. And then number 5, when you have inability, like you're struggling to conceive, infertility. And then this one I can say also early miscarriages, like you're losing the pregnancies very, very early on in your first trimester. That could be also a reason. That could also show that you have low progesterone hormone. And finally, when you have estrogen, like your estrogen hormone is so high, you're gonna have estrogen dominance. And this one can be you can know that you have estrogen dominance when you are feeling extremely bloated. The bloating is not good. And then you have things like fibroids, when you have things like extremely heavy periods, problem, progesterone. You need to balance your progesterone. So that is very important for you to know. If you have all of these symptoms, it is a good place to start balancing your progesterone. Very, very important. So for the sake of the length of this video, the next video we're going to talk about what causes a low progesterone hormone, because you can see that without a good balance of this hormone, you're gonna have a lot of problems as a woman. So we're going to talk about what causes low progesterone hormone and also how you can be able to balance it off. And just to mention, if you'd like to know like where do I begin, I have hormonal imbalance or I have all these symptoms, what do I do? You can reach out to me. You can book a private session with me. We go through this. I'm gonna teach you what you need to do. These are things that I've also done. I specifically had this estrogen dominance, and the PMS symptoms were extreme. And I also had this early miscarriage, and that shows you that my progesterone was off. And these are things that I also have struggled with and overcome. So I want to teach you how to heal yourself also. So reach out. You can reach out to me by booking a private session. There's a link there in the video description, or if you're watching this from TikTok, there's gonna be a link there on my profile. Just click on my name, go to my profile, click on it, book a private session, or just WhatsApp me via this number here. And yes, so the next video we're gonna talk about what causes low progesterone hormone levels and what you can do about it.